Imagine standing in your kitchen late at night, turning on the tap, and hearing the steady rush of clear water. It feels ordinary, unremarkable. Yet this simple act, filling a glass with safe drinking water, is one of public health's greatest triumphs. For much of human history, water carried invisible threats. Cholera, typhoid, dysentery. Millions died from something as basic as a sip of water. Today, water systems with pipes, filters, and treatment plants protect us. That unassuming glass is a symbol of centuries of progress. Progress we rarely notice until it's gone. In tonight's episode of the Restful Record, we learn about public health, a discipline that quietly shapes the way we live, often saving lives before we even realize it. But before we dive in, let's take a moment to relax. Close your eyes, settle into a comfortable position, and take a slow, deep breath in through your nose. Hold for a moment, and then exhale slowly through your mouth. Let the weight of your day melt away as you breathe in calm and breathe out tension. With each breath, feel yourself sinking deeper into relaxation. Public health is the science and practice of protecting the well-being of entire communities, not just treating individual illness. It focuses on prevention, safety, and the systems that keep us healthy every day, like clean drinking water, vaccines, sanitation, and policies that reduce harm. When you wash your hands, buckle a seatbelt, or breathe air free from smoke and pollution, you are experiencing public health at work. It's the invisible shield that quietly saves millions of lives. Some of the earliest examples of public health date back thousands of years, when ancient societies began to understand that health was tied to the environment. In the Indus Valley around 2500 BCE, cities like Mohenjo-Daro and Harappa built drainage systems and public baths to keep water clean. Ancient Egyptians promoted hygiene through regular bathing and burial practices that reduced disease spread. In ancient China, records from the Zhou dynasty around 1000 BCE describe quarantine practices and medical examinations for soldiers, showing concern for controlling disease in communities. In Mesopotamia, Hammurabi's Code, circa 1750 BCE, set rules for sanitation and medical accountability. The Inca Empire in South America, centuries later, developed terraced agriculture and irrigation systems that prevented famine and improved nutrition across large populations. But perhaps the most famous early achievement came from Rome. Beginning in 312 BCE, with the construction of the Aqua Appia, the Romans developed vast aqueduct systems that carried fresh water into cities and flushed waste away. These early efforts showed that collective well-being depended not just on medicine, but on the design of the places where people live. One of the earliest and most devastating reminders of the need for public health came during the Black Death of the 14th century. Sweeping across Europe, the plague killed nearly a third of the population in just a few years. Whole villages were abandoned, trade routes collapsed, and families vanished overnight. In desperation, cities experimented with crude public health measures. Ships were forced to wait in harbors, homes were sealed, and the sick were isolated. As plague ships approached the port of Venice, officials imposed a radical idea. Passengers and crew would be held on islands offshore for 40 days before entering the city. They called it 40 giorni, from which we get the word quarantine. These early measures weren't perfect, but they showed an emerging understanding that disease could spread invisibly from person to person. For the frightened Venetians, the wait was agonizing, but for the city, it was survival. The practice of quarantine became one of humanity's first coordinated tools against epidemics. In Milan, the authorities went so far as to wall up infected houses, trapping both the sick and the healthy inside, a brutal attempt to halt contagion. Throughout the 15th and 16th centuries, plague doctors became a fixture in European cities, dressed in long coats and beaked masks, filled with herbs to ward off foul air. In 17th century London, the government created bills of mortality, weekly printed lists of deaths and their causes, which allowed citizens to track outbreaks in real time. These measures were often imperfect, but they signaled a shift. Societies were beginning to treat disease not as random fate, but as something that could be observed, recorded, and perhaps even prevented. For millennia, people have battled with infectious disease. Long before the word vaccine was coined, people around the world had already begun experimenting with ways to protect themselves from smallpox, one of history's deadliest diseases. In China, as early as the 10th century, healers practiced variolation, grinding up scabs from a person with a mild case of smallpox and blowing the powder into the nose of a healthy person. In parts of Africa, including among enslaved people later brought to the Americas, smallpox material was scratched into the skin, producing a controlled infection that was often far less dangerous than the full disease. These methods were risky, but they worked often enough to reduce outbreaks and keep communities safe. By the 18th century, variolation had spread into Europe. In 1721, Lady Mary Wortley Montagu, the wife of the British ambassador to the Ottoman Empire, observed the practice in Turkey and brought it back to England, even having her own children variolated. The idea of deliberately giving someone a form of disease to protect them was controversial and frightening, but it also sparked debates and hope. Variolation represented one of the first widespread public health practices, built not on superstition, but on observation and trial. It was Edward Jenner in 1796 who pushed the idea further. In the English countryside, Jenner noticed that milkmaids who contracted cowpox, a mild disease, rarely fell ill with smallpox. To test his theory, he scratched fluid from a cowpox blister into the arm of an 8-year-old boy named James Phipps. The boy became mildly sick, then recovered. Later, Jenner exposed him to smallpox, a shocking experiment by today's ethical standards. But James did not fall ill. Jenner had proven that cowpox could protect against smallpox. His experiment gave the world the first modern vaccine, named after vacca, the Latin word for cow. From those early beginnings, Chinese healers, African practices, Ottoman variolation, and Jenner's cowpox experiment, vaccination grew into one of the most powerful tools in human history. Nearly 2 centuries later, the world united to wipe smallpox from existence. In the 1960s and 70s, teams of health workers traveled on foot, by jeep, even by canoe, to reach remote villages. They carried freeze-dried vaccines and special bifurcated needles that allowed quick, simple inoculations. The strategy was called ring vaccination, finding a case, then vaccinating everyone nearby. Stories abound of vaccinators arriving at huts in the dead of night or carrying supplies on camels across deserts. In 1980, the World Health Organization declared victory. Smallpox was gone, the only human disease ever eradicated. The 18 and 1900s were important centuries of transformation for public health. In 1854, a cholera outbreak gripped London's Soho district, killing families within hours of their first symptoms. Dr. John Snow, a physician skeptical of the popular bad air theory, began knocking on doors. He plotted cases on a hand-drawn map, each death marked near one source, the Broad Street water pump. When authorities finally removed the pump handle, the outbreak subsided. Snow's careful detective work laid the foundations of epidemiology, the idea that disease follows patterns we can trace, study, and stop. One simple map forever changed how we understand health. Only 4 years later, in the summer of 1858, London was suffocating. The Thames River had become so polluted with human waste and industrial runoff that the air itself stank, an event known as the Great Stink. Lawmakers in Parliament, their chambers, perched on the riverbank, could no longer ignore it. Curtains soaked in chloride of lime failed to mask the odor, and debates had to be suspended. The crisis forced the government to act. Commissioning civil engineer Joseph Bazalgette to design an ambitious sewer system that transformed London. It was a turning point, proof that sanitation, not just medicine, could save a city. Around the same time, in military hospitals of the Crimean War, soldiers were dying not just from battle wounds, but from infection and poor sanitation. Florence Nightingale, armed with a lamp and a notebook, recorded the causes of death with painstaking care. She transformed her notes into visual diagrams, striking pie charts that showed how cleanliness and proper ventilation reduced deaths more effectively than surgery. These coxcomb charts were revolutionary, not just in medicine, but in statistics. Nightingale proved that data, beautifully presented, could be as powerful as compassion in saving lives. In 1885, Louis Pasteur faced a desperate case. A young boy, Joseph Meister, had been mauled by a rabid dog. Rabies was always fatal once symptoms appeared, and the child's family begged Pasteur to try his experimental treatment. Pasteur had been working on a weakened form of the virus, testing only in animals. With trembling hands, he injected Joseph with a series of doses. The boy survived, the first human saved by a rabies vaccine. The case cemented Pasteur's reputation and offered hope that science could not only understand disease, but prevent it. At the turn of the 20th century, tuberculosis was called the White Plague, haunting cities across Europe and North America. With no cure, doctors prescribed fresh air, sunlight, and rest. Sanatoriums were built high in the mountains, where patients would spend months or years reclining on open-air porches, bundled in blankets, even in the snow. Letters and diaries from patients reveal lives suspended between hope and fear, waiting for a recovery that often never came. By the early 20th century, medicine had made extraordinary leaps, but new challenges were emerging. Rapid industrialization, world wars, and growing urban populations revealed how deeply health was tied to the social environment. In the final months of World War I, soldiers returning home carried with them more than battle scars. A new influenza virus, unusually deadly, swept through barracks, ships, and cities. By 1919, it had spread across the globe, killing an estimated 50 million people. Entire towns were left without doctors or gravediggers. The Spanish flu showed how interconnected the world had become, and how quickly disease could travel on ships and trains. The pandemic also changed culture. Masks became commonplace, and public gatherings were banned. The rise of modern public health was no longer just about fighting germs. It became about improving the conditions in which people lived, worked, and aged. Governments began investing in sanitation, nutrition, and education. And for the first time, health was seen as a right to be protected rather than a privilege to be earned. When Alexander Fleming noticed that a common mold was killing bacteria in his lab dishes, he couldn't have imagined the revolution he had started. By the 1940s, penicillin was mass-produced and saving soldiers' lives on the battlefields of World War II. For the first time, infections that had once been death sentences, pneumonia, sepsis, strep throat, infected wounds, could be treated effectively. It's estimated that antibiotics have saved over 200 million lives since their discovery. One of the greatest triumphs in public health history. Yet, as their use spread, so did a new threat: antibiotic resistance. The same tool that once conquered infection began to lose its power. A reminder that even miracles require stewardship. Around the same time, a story unfolded that continues to challenge how we think about ethics and equity in medicine. In 1951, a 31-year-old African-American woman named Henrietta Lacks went to Johns Hopkins Hospital in Baltimore for treatment of an aggressive cervical cancer. Without her knowledge or consent, doctors took a small sample of her tumor cells. Those cells, later called HeLa cells, turned out to be unlike any others. They reproduced endlessly, becoming the first immortal human cell line in history. HeLa cells were used to develop the polio vaccine, study cancer, and test the effects of radiation, saving countless lives. Yet, for decades, Henrietta's family had no idea her cells were being used around the world. Her story sparked conversations about consent, race, and the rights of patients, issues that continue to shape public health research today. As scientific knowledge expanded, so too did the scope of public health. In 1948, the creation of the World Health Organization marked a new era of global population. For the first time, nations agreed that health was a shared responsibility. Campaigns to control tuberculosis eradicate malaria, and bring clean water to remote regions reached across continents. Public health became not just about curing disease, but about building systems that could prevent it. Still, access remained uneven. In many parts of the world, poverty, colonization, and conflict left communities vulnerable to disease that wealthier nations had long forgotten. The late 20th century brought new crises and new lessons. The HIV/AIDS epidemic of the 1980s forced the world to confront not only a deadly virus, but also the stigma, discrimination, and political neglect surrounding it. Communities of activists, health workers, and researchers joined forces, transforming grief into advocacy. They demanded compassion, funding, and fair access to treatment. Public health began to recognize that saving lives required more than medicine. It required social justice, education, and empathy. And as the world grew more interconnected, so too did the spread of disease. The 21st century has had its share of infectious disease outbreaks. I am going to share 4 major disease outbreaks of the 21st century, though there are bound to be many more before the turn of the next century. In February 2003, a single doctor from Guangdong, China, checked into room 911 at the Metropole Hotel in Hong Kong. He was ill with a mysterious pneumonia, later known as SARS. Within 24 hours, he had infected over a dozen other guests, who then boarded flights to Toronto, Singapore, and Hanoi. The hotel became the epicenter of a global outbreak, showing how a single night in one building could ignite a chain of disease across continents. 7 years later, after the devastating earthquake in Haiti in 2010, a silent second disaster struck: cholera. The disease, almost unknown in the country for over a century, appeared in rivers where survivors drank and bathed. Investigations traced the source to a UN peacekeeping camp, where poor sanitation allowed the bacteria to leak into waterways. Suddenly, hospitals overflowed, and entire families fell ill within hours. Over 10,000 people died. The outbreak revealed how fragile public health systems can be in crises, and how quickly trust erodes when outsiders bring more harm than help. Another disease hit the same decade, but has a long history in Africa. The Ebola virus is one of the most chilling reminders of how fragile public health systems can be, and how courage and coordination can make the difference between chaos and containment. First identified in 1976 near the Ebola River in what is now the Democratic Republic of the Congo, the virus causes severe fever, internal bleeding, and often death. For decades, outbreaks flared in remote villages, but in 2014, Ebola spread rapidly across West Africa, overwhelming health systems in Guinea, Liberia, and Sierra Leone. Entire communities were devastated, families were unable to bury their dead, and health workers risked and often lost their lives. Yet, amid the fear, remarkable cooperation emerged. Local volunteers, global agencies, and scientists worked together to trace cases, educate communities, and eventually develop an effective vaccine. The Ebola crisis became a stark lesson in global health, showing that controlling disease is as much about building trust and communication as it is about medicine. And in 2020, the COVID-19 pandemic reminded us that an outbreak anywhere can become a crisis everywhere. Within months, borders closed, economies halted, and daily life transformed. The pandemic exposed deep inequalities, those already vulnerable to the harshest impacts. Yet it also showcased the power of global collaboration as scientists around the world worked together to develop vaccines in record time. It was a vivid reminder that public health is both ancient and modern, rooted in timeless ideas of community protection, yet constantly evolving with new tools and challenges. Other infectious diseases have been nearly eradicated thanks to purposeful vaccination campaigns. For example, polio, once a global scourge that paralyzed children by the thousands, is now almost gone. Thanks to mass vaccination campaigns, it remains in only a handful of regions, largely in Afghanistan and Pakistan. There, health workers travel through dangerous terrain, sometimes at risk of violence, carrying coolers of vaccine door to door. Each dose represents a step toward eradication, a second potential triumph after smallpox. Yet resistance, mistrust, and war still stand in the way. Polio's near defeat is a story of both hope and unfinished work. Today, public health is entering a digital frontier. Scientists are using artificial intelligence to scan online data, flight patterns, and even wastewater to spot outbreaks before they spread. During COVID-19, some of the earliest alerts came not from governments, but from AI systems that noticed unusual pneumonia clusters in China. Genomic sequencing now allows scientists to track mutations in real time. It feels futuristic, but it's already here, a marriage of technology and medicine that may one day allow us to stop the next pandemic before it even begins. In 2025, public health stands at another crossroads, balancing science, ethics, and compassion. Climate change, mental health, antibiotic resistance, and misinformation all pose new threats, but the heart of public health remains unchanged. It is the shared commitment to prevent disease, prolong life, and promote well-being for all. From ancient aqueducts to quarantine laws, from HeLa cells to global vaccine drives, the story of public health is, above all, the story of humanity learning to care for itself. Thank you for joining us on tonight's episode of the Restful Record. Rest well.